Early diagnosis opens the door to future care and treatment. That's why millions of women get their annual mammograms and millions more get colonoscopies. Today, we're focusing on our brain health, our cognitive health. In other words, our thinking, remembering, and learning. All important functions that none of us want to lose. Joining me are Dr. Heidi Hill and Dr. Jill Davis, both audiologists who have been using a new technology in their practice. Based off of FDA-cleared technology, it's practically new, which is great. This offering can identify patients who may have declined in their cognitive performance, ultimately helping to manage cognitive decline and elevate the standard of care for a healthier life. Welcome to both of you.
Thank you.
Dr. Davis, let me start with you. Let's just do, some anatomy here. Cognitive health, it's really who we are. What affects it? What are the risk factors for us to lose it?
There's quite a few, and one of the biggest is untreated hearing loss.
Really?
Yes.
Untreated hearing loss. Why so?
So the brain starts to compensate to make up for that lack of stimulation, and so we start seeing an increase of cognitive load. We have to start looking at the patient or at the person that we're talking to. Right. Our eyes take over our ears, and then in effect, we can also see vision loss causing some changes as well.
Is age another factor?
Age is a factor that's also related to hearing loss. Also sleep disorders, chronic depression, anxiety, unhealthy lifestyle, diabetes.
Okay, Dr. Hill, so if left untreated, what can happen? And I guess my other question would be, does someone notice that it's happening?
So it's difficult to detect mild cognitive impairment, just as age-related hearing loss is difficult to detect. They're both very gradual, and they don't necessarily impact day-to-day activities, but it's really important to identify them so that we can modify risks before it starts to progress more.
Because then over time, that's what happens.
Over time, that's what it happens, and we kind of have a window of opportunity to intervene both with hearing loss and to refer for cognitive decline in just making some modifications in lifestyle.
Dr. Davis, at the beginning of the segment, I mentioned a new FDA-cleared technology, which is right here. It's called Cognivue. So first, let's talk about how it works.
So this is the machine that the patient is going to use to do the screening. So it starts with a 4-minute video, explains the test and what they're going to be looking at. From there, they jump into just the 5-minute assessment. They're going to use the Cognivue to answer questions. It's calibrated for each individual for their vision and dexterity. And so the great thing about this is we have not had this tool before. We've known there's a correlation between hearing loss and cognitive decline, but we haven't had a way to test it until now.
So with the information that you receive, then you determine what? How do you proceed?
So we do next steps to help them. So we want to address their hearing loss if that's there. If we see any kind of concerns that come up, we need to come up with a treatment plan to stop any further progression.
Okay, Dr. Hill, quick question. When you use this with patients, do they get a little bit intimidated? Somebody might be thinking, wait a minute, are they going to diagnose dementia on me?
When I introduce it, because that's not what I'm looking for, I let the patient know this test is going to be looking at how your brain processes in areas that are important for hearing, particularly in noise. I'm really gathering information with this tool so that I can better determine how to counsel the patient, treat the patient, and set up a management protocol.
I want to turn now to a few patients that we actually met who are actually taking the screening test and talking about the benefits. Let's take a look, shall we? Let's do it.
When you're ready to watch the video, you just turn that wheel.
Performance is how your brain performs. Like your cardiovascular health or other important functions of your body, brain health should be a part of your routine health checkup.
This test is important because of the ringing in my ears and cognitive decline.
Part of our treatment promise to you is this is important, and we're going to track this at least once a year, if not twice a year.
Okay. It helps you as a person, in your mind, as far as where you stand right now.
I'd noticed over the years that my hearing was, like I couldn't hear people walking behind me.
Now I'm going to give you a 5-minute brain health screening test.
Before each exercise, you will be provided with 2 practice sessions.
I I guess things just started to gradually get worse, maybe the last couple of years.
The exercise requires you, to the best of your ability, attempt to keep the green wedge on the moving white dots.
Now I'm going to test you again at the 1 year mark, maybe even in 6 months. We'll see.
I'm really glad I took the test because it really did demonstrate, to me anyway, that there's been some change over the first 3 months when I started wearing the hearing aids. And I found that kind of surprising. But I wouldn't have known that if I hadn't have taken the test.
Ladies, I mean, this is truly a real game changer and such an easy screening, right, Dr. Hill?
It really is. It has, in my practice, allowed me to change the way that I counsel patients from just focusing on hearing loss and hearing aids to really the whole auditory system, which is ear to brain, which most people don't understand. And it allows the patient to connect those dots between what's going on and what they're experiencing in the real world.
And Dr. Davis, what advice would you give to anyone out there who may be suffering from mild cognition impairment or maybe knows someone? And again, this is new. A lot of people don't know about it, so it's important that we raise that awareness.
Absolutely. Early detection is key, and so we want to catch it as soon as we can, starting with a hearing test, mentioning to the physician we're starting to notice some changes. Just getting that screening is the first step.
Can you imagine something so easy can make such a world of a difference? Dr. Hill, any final words?
My advice would be, if you're concerned about a loved one, you need to become involved in those appointments. And I would approach a loved one or a parent and say, I'm concerned because I'm having a hard time communicating with you. I would put it on me and how it's impacting me and that I need to get help. I want to learn how to better connect and communicate with you.
Great stuff. Thank you so much, ladies, for your time, for all the information, and of course, the patients that were willing to share their stories. Thank you to them as well. For our viewers who'd like more information, where can they go?
Earbrain.com.
Earbrain.com. Great website, because there is a connection. Thank you again, doctors. Appreciate your time. For more information, go to our website, thebalancingAct.com.